welcome to this panel of day 2 of the Impact Forum. I'm Linda Gibbs. I'm a principal at Bloomberg Associates, but the reason I'm here is that I was the Commissioner of Homeless Services in New York City before I became the Deputy Mayor. And now at Bloomberg Associates, I work in many cities across the globe on this issue of homelessness. And so I'm pleased to be here with you all this morning. Let me introduce our panelists to discuss the issue of managing the challenge of homelessness in urban centers. Mark Eichenbaum from Houston has just made it under the wire. Mark, thank you. I know you're still maybe haven't had your Wheaties yet this morning. And so we're really pleased to have you here from Houston, Texas. Mark is the, it's a special assistant to the mayor of city on the issue of homelessness. Special assistant is an understatement. Some would call him the homeless czar. He is the guy who pulls it all together in Houston across the many partners. My colleague, Tamaru Mamo, also at Bloomberg Associates, and together we have just released a book called, and I can't remember the title of the book, it's way too long, how 10 global cities take on this challenge of homelessness, innovations that work. That's based on our experience across the cities that we have worked in. And somebody who is a stranger to none of you, Jeremy Swain. Jeremy has, by his bio, I know he has spent his life dedicated to this issue, starting as a street outreach worker himself, and then going all the way up to the top of the UK government leadership on this issue, seconded from, I love the word seconded, we don't use it in the US, so I use it whenever I can in meetings in the UK, to the MHCLG from Thames Reach, where he was executive director, but then working at the national level in the UK on developing a rough sleeping strategy for the country as a whole. We're also joined by Lorraine McGrath. Lorraine is the chief executive of Simon Community Scotland, and she's going to tell us about the challenges and some of the bold plans that they have going on there. And first and among us is Connor Gurney. Connor has joined us from his offices where he's been working in person for the past year. So all of us who have enjoyed doing work in our pajamas for the past year, we should be ashamed because Connor has not stopped going to the office every day as an exec of a tech firm, and which he has established and is managing. And Connor has experienced homelessness himself, and we want to hear what that experience has been like and help to reflect on how all of this work is, what it's all about. So let me start. What we're going to do is just have an opening reflection from everybody, and before we move to a little bit of discussion and then to some Q&A. So for folks who have joined, I encourage you to put any questions that you have into the Q&A box, and we'll be monitoring those and try to pull you into the conversation as best we can. So let me start. Tamaru, why don't you open up and share? We've been working in about a dozen cities in the past few years on this issue of homelessness. What reflections on the particular challenges of managing in urban centers?
So hence the topic of the book that Linda mentioned. So I work with Bloomberg Associates, and we're a pro bono consulting firm that works with cities around the globe. And so as part of our experience in writing this book, we worked with 10 cities, and I guess there definitely are commonalities between the cities, and we're talking about a diverse group of cities, from Bogota to Mexico City to Paris, France, to Athens, Greece, and New York City, and Houston, Nashville, and Baltimore, and LA, and so it's quite a diverse list. But we started to see commonalities among these cities, and so some people might even call them complaints about the challenges faced by the different cities. And I would say, I'd start off and say that cities said that they had low levels of national initiative. We didn't work with any UK cities. Just want to say that in this book, we do work with UK cities now in our practice Bloomberg Associates, but we didn't cover any in this book. So I'll just say that for just to start off. So so complaints of low national initiative, and I think that means really funding as well as kind of a very robust strategic plan. Something along the lines of Finland, is I think kind of the ideal out there. But that was a complaint that from many of the cities that they had low levels. So at high and shifting needs, a growing problem. There was not one city where they didn't face a challenge of a continual movement to the street, even in places like Houston.
And Kamaru, I'm just going to mention your mic seems to be going in and out.
Sorry.
So, no, as you move your head, it just fades away. So
okay,
yeah, lean in a little.
I'll hold this a little. So
so what would be so what would be the the strongest observation that we've worked across all these cities? What do all these cities what is a common challenge that they have to grapple with in dealing with urban homelessness?
Sure. I mean, first of all, it's the concerns of citizens as well. Citizens, I think, have dual mentalities. They want to help people, but they don't like seeing people on the street. I think it disturbs them. In some cases, they just they oppose having services such as a shelter in their communities. We see that a lot. Economic concerns, rising housing prices, low wages that can't keep up with rents. And then overall limited resources for the city itself. Not enough support from the national government. Like I said before, it's not just the initiative and strategic vision, but resources. And then, I think cities are willing to innovate and take chances, and we're starting to see that more as that innovation really is needed to have an impact. And also, I think you see a lot of complaints about support systems, healthcare systems, lack of access to behavioral health systems, housing supports, and then a big one internationally is a change in role of families, where you just don't see the same type of support in the past in places like Greece or Mexico City, where historically the government didn't have such a big role in providing housing and support, as that for some reason the family bonds were not as strong and people were moving to the street. So those are some of the commonalities that we see among cities. Around
and implicit in what you're saying is that the citizens of cities look to the mayor to solve this problem. And many, mayors don't have the statutory responsibility in most places to deal with homelessness, but the citizens, it's like front and center, and you expect your government to do something about it, both humanely address the needs, but also address the quality of life, both of those things going on, and it comes down on the mayor's desk.
The mayor can't escape it. That's a big thing. So you may not control the systems, but mayors often get blamed for the problem, and so you can't avoid it. You can't hide from it.
So let me jump over to Lorraine. Lorraine, tell us about what's going on in Scotland. We really eager to hear about the new plans that you're working on.
So at Sand Community Scotland, we probably work with about 6,000 people a year, and the vast majority of them are within the two major cities of Glasgow and Edinburgh in Scotland. So it's kind of in that context. And I would agree with everything that Kamaru was saying there about kind of city-centred or city localities being a real challenge. For us, the big challenge is the complexity that comes with being working across a big city, the complexity of the systems then that people have to navigate, that even providers have to navigate, planners have to navigate in terms of planning responses for people experiencing the most extreme forms of homelessness, particularly rough sleeping. In Scotland, what we've done is we've looked to that and actually looked at a rapid rehousing agenda and required all of those local authorities, including those that cover the large cities, to come up with a plan that can respond to people much more effectively from a whole system point of view. But the big challenge is that within those cities, you're navigating such complexity, such a siloed approach, necessarily so because they're reaching such a big population, that's a real, you're turning tankers all over the place. What we found, particularly in the last year and in other parts of the system, that actually you can transcend that a little bit and go to that people-to-people connection, and where you really empower that at the front line of delivery, although front line's becoming a more difficult word to use these days, and I've not come up with a better one yet. If anybody's got any suggestions, I would love to hear it. But particularly in the early days of the pandemic, where people who are concerned with that human-to-human contact on a general basis felt empowered to just do stuff, to just make stuff happen. And I think there's much more potential in the system, whether it's a city-wide approach or whether it's just an individual organisation, to do much more of that in terms of providing that resolution. And what that did last year is we're really proud to have been part of driving a multi-agency approach in each of those major cities, which got us down to single figures on the street.
Wow.
Single figures in each city. And that has pretty much been maintained. And that was largely about people feeling permission to ask and act and do things at the front line of delivery, right across the system. Right across the system, from health, housing, commissioning, planning, voluntary sector, volunteerism. The whole system felt empowered, and the pandemic gave us that permission. And I do think that the pandemic's still giving us a permission to do even more of that, as we recognise that we're all a bit fearful about this kind of rising tide of unmet need that's building up because of the economic impacts. And I do think that there's a way to reach further out into the system and give us those same kinds of permissions to frontline staff who are the human-to-human contact and can use that relationship much more effectively. We've been doing some work with the Department for Work and Pensions through the benefit system in Glasgow to do just that, to empower the people who are engaging with people around their benefits claims to just ask the question about their housing status and ask if they feel safe about their housing status, and then to act by connecting them with us. And we're already reaching lots of people. And I know there's loads of good examples elsewhere. Newcastle's been doing some incredible work with DWP, and in London as well. So that they're just small examples of if local leaders are able to just say to their team, let's do something now, I think we can start to get a bit of a groundswell going of culture and expectation and change, and then we can learn with each one of those elements of the system about where we're at with that person and where people are most likely to make those points of connection and where we can most likely respond and prevent that point of crisis. Because we're getting really good at responding at the point of crisis, but it's obviously better for all of us if they never reach that point of crisis in the first place.
So interesting. So you say both stronger coordination at the top, the systems integration, getting kind of the people running the policy choices at the top to coordinate better, but then unleashing the discretion at the front line, at the people relationship level. And how did that word get out around, the frontline workers just get out there and problem solve? Just, did you say, we don't care if you break the rules, we don't care if you make it up on the fly, we want you to figure it out? How did you communicate that out?
Pretty much, it was like, what can we do? It was emergency, crisis response. What can we do? The kind of empowerment of the front lines being part of the National Action Plan and the National for Ending Homelessness Together, and various models of that practice have been tested and tried out through things like small personalised budgets being given into the hands of a frontline worker to act and to use a small spend to prevent rough sleeping, to being able to make kind of group key worker responsibilities. So we have interagency street networks in each city that are the frontline workers that come together and share their own expertise, and they are a decision-making process, so they can make decisions about how their resources are deployed in the interests of that person that is of most concern. So within homelessness, it's become more of a kind of natural response. But the pandemic and full lockdown hitting last March created the opportunity for others to do the same, to just say, right, what can we do now?
Yeah.
Let's do this. And yes, lots of professional boundaries were cast aside, lots of institutional barriers were cast aside. The rule book pretty much was ripped up, and only good stuff happened. And I think that's why being able to maintain that kind of energy at that bit in the system.
Yep.
But that's not, at the moment, we're not using that to reach people systematically who are becoming at risk. So if we can kind of bleed that same energy and that same kind of permission and perspective out into the wider bits of the system, just by the local leaders giving permission to that in the context, even if it is in the context of the ongoing pandemic and the rolling out of the pandemic impacts.
One of the biggest challenges, how do we sustain the level of innovation that happens during an emergency into the world of kind of the slow chronic burn of emergency that homelessness is? How do we keep that? So let's jet over to Houston, Texas. And Mark, we're curious, that's such an interesting reflection by Lorraine there on how things evolved in Scotland. Same, different, what was your experience there in Houston? And, it doesn't have to be limited to the pandemic, but you're really a leader in the US in terms of tackling this issue. So we're curious both, the longer story plus what you saw happen during COVID.
Oh, thank you, Linda, and congratulations to you and Tamaru on your book. We've been enjoying it here in Houston.
I'm glad somebody has the name. I forgot what it is.
It's great. I think Lorraine really hit the nail on the head. It's about looking at it from a system and creating a system. I think in the greater Houston area, which is a population of around 7 million individuals, it's really the only social issue that has a true method to the madness system. A coordination around it. And that's why we're able to get major impact. And so in the Houston area in 2011, we had the 8th largest homeless population in the United States. We had over 8,500 individuals that were homeless any given night. We decided we needed to do things differently. It was really elected leadership that challenged the homeless response community to say we need to rise above anecdotal stories of success and really move the needle. And that's huge because we all know that every agency parades an individual John Doe out there and talks to funders and to the community and to supporters about how they transform John Doe's life. And that's great. But we care less about John Doe because we care about thousands of Johns, because we have to create a system that can house thousands of John Does to move that needle. And everything we want to do, we want to bring it to scale so that we can move that needle, because that's the only way we can get major reductions in large urban areas. And so from that challenge came a 3-day community charrette with over 400 participants. And, folks said, we got to do things differently. We're spending tens of millions of dollars every year, and all we're getting is anecdotal stories of success. And so from that became the 2 major pillars in Houston. And the results have been, we now have the lowest per capita homeless population of any major city in the country. We have cut homelessness by over 55%. And we are laying the tracks right now to reduce it in half once again. So the major
those 2 pillars, that what you're coming to?
So the first one is really focused not just on collaboration, collective impact. And the difference is when we talk to homeless agencies and ask them, do you collaborate with each other? The answer was always like, of course. So we'd say, well, tell us about it. And they would say, well, I go to lunch every month with this agency's executive director. Or, during Christmas, we do a clothing drive. What we're talking about is the day-to-day activities and resources really being coordinated and combined to raise that collective impact. So now we have over 100 different agencies that are all part of, we call it the Way Home. This is our homeless housing system. And that means 100 different agencies have the same set of goals, shared goals, and the same set of shared strategies. The second piece is that we said we're going to only invest our limited dollars into data-proven strategies. And so if we had 10 agencies around the table and I said, I got $100 million to invest, I'd probably get, and I said, where should we invest it to get the biggest impact? I'd probably get 10 different answers. So now we say, back it up with data. We want to see it. To us, the data is clear. Housing is the answer. Permanent housing is the answer to homelessness. And since 2011, we have permanently housed more than 21,000 individuals experiencing homelessness, with 90% of them staying housed 2 years after their placement. The housing and the services keeps the individuals housed, and the housing is what makes the services effective. So when, we had to come to some realizations. We were valuing utilization over impact. Just because a program might be being used doesn't mean it's having the impact that you want. So we only look at two key metrics for impact. We look at our homeless count, our annual homeless count, even though it's not precise, because it's conducted the same way every single year, we can compare each year and look at trends. And then the second piece is how many people we're housing. If it does not, so we're talking about mobile showers for the homeless. We're talking about any of those other sexy, stories that dominate. If it is not going to move that needle and get people off the streets, we cannot invest money in it, nor are we going to spend our precious time on that. So that's what we're really looking at. We try to build units. And when we can't build units, because it's hard to site that in urban areas, then we do scattered sites. And we're going to apartment complexes across the city, across the region, getting 2 units here, 1 unit there, 20 units there, really piecing it together. And we're not trying to fix individuals. A typical person who goes through substance abuse detox, it's going to take 7 times. They have to go through it 7 times. We don't have the time to wait for that. So what we're really focused on is getting the person off the streets. And what we found is the huge amount of cost savings once we do that. And what we found is that all those other issues end up being reduced just by getting the person off the streets. And that's what we've had to sell to the constituents. That's what we've had to sell to elected officials, is not only is it the right thing to do, the compassionate thing to do, the moral thing to do, but it's the fiscally conservative thing to do at the end of the day.
Which because Mark is from Texas, he has to say that. As we know, the pressure, and it gets back. So Jeremy, let's come over to you. We heard the issues of mayoral leadership and the demands of the public on mayors to address this problem, which is very visible in large urban centers. We heard from Lorraine, the systems coordination, but unleashing the front line. And then from Mark, the really strategic use of resources coordinated across partners working together. And, and every mayor is under pressure of how much money it costs. And in more conservative areas of our, countries like Texas, also under incredible fiscal pressure just to keep government spending down in general. So you're working with some really tight constraints. How does this add up in your mind? Is this kind of the template that you see happening in cities? And now that you've had a chance to to control the national budget and deploy the resources in the way that you see necessary, how have you navigated that from kind of this experience you've had as a national leader?
Linda, if I could manage the national budget, that would make me very happy. Very.
But it comes with the deficit. That's always the downside.
Never had that much power. One thing I would say, because the earlier question was, how is it different in urban areas? And I think one of the most interesting things is how different every urban area is. So when I was the civil servant going around the country with the Secretary of State for Housing, we visited in across the country different major cities. So you go to Manchester, and essentially what they'd be saying is, we've got a special problem here because we've got issues around affordability, we've got pressures on our housing stock unlike any other city, and also people come into the city because they think they can get work. Sometimes they're coming in to beg. We've got particular issues, and we've got issues unlike no other city around crack misuse and heroin. So we'd go on from Manchester, and a week later we'd be in Bristol, and Bristol would be saying pretty much the same. Okay, so most cities believe that they're sucking in a problem in many ways, and I think that they would say that there's issues around affordability. Now, my judgment about that is that some make a stronger case than others, and actually going around the country, it's amazing how different cities are. So, for example, in the northeast, in Newcastle, they have a different issue around stock there. They have more social housing. They may still have problems about access and accommodation, but it isn't the kind of issue you'd have in London. Similarly, Birmingham in the Midlands of our country, they have more access to the private rented sector. It may not be what they want in terms of quality, but it's very different from other parts of the country. So I think there's a danger in seeing urban areas the same. And just to make the case for the rural areas, because my eyes were open to the issues facing rural areas, in the west of the country, in Cornwall, the outreach teams are covering hundreds of miles. They have got to get around. The street teams are not street teams, they're mobile teams having to cover massive areas, finding people in small towns with all the challenges that involves. So I think there are issues facing the urban centres, but we also need to acknowledge how difficult it is sometimes to deal with homelessness in other parts of the country, in towns and in rural areas. I think in terms of what we achieved, I joined the task force last year, the COVID-19 rough sleeping task force led by Louise Casey. So as part of this task force, we had to rush into action, and we got 90% of rough sleepers off the street in that first phase in March and April. And broadly, numbers are staying pretty low across the country. So in London, when I looked at the figures from last week, there's round about 600 people now sleeping rough on the street. So we've got the kind of problems that are very small in comparison to what I've seen in the States, both in New York and Los Angeles, even Boston. The size of the problems is relatively low. But what happened in March of last year was a central government edict, essentially, for everybody to come in. So the announcement went out from the housing minister: we want you as a local authority to get everybody off the street, because we now have a health issue that has actually blown our minds in every way. And essentially, this is about responding to the risk of people dying. So we want you to get people in off the street into accommodation. And it was hotel accommodation, as I know it has been in the States, where people can be protected and where their health can be maintained. And obviously, most importantly, they can avoid the infection. But the point I'm making is that wasn't a local direction. It wasn't done on a regional basis. It wasn't done by cities. It was directed by central government. The important thing was that the relationship between the central government, who have been funding expert advisors in the main homelessness and rough sleeping directorate to work with cities, and in fact all local authorities, was so strong. The relationship came together brilliantly, and we collectively managed to make the changes we achieved. But the really important point is, I think that, interestingly enough, in this country, during a moment of crisis, it was very much a central government direction to do what was achieved. Now, the big issue now, as we're all actually reflecting on, is how do you keep that sense of urgency going?
Right.
If you haven't got the fear of dying through an infection, how do you keep that going? Because we've got fantastically low numbers in comparison with what we had before. I don't want to be complacent. We've got some temporary accommodation figures that are very worrying in terms of people being placed in situations which are far from ideal. But that is the big challenge. And this has to be led by the urban centres, because they have the highest numbers still. 26% of rough sleepers in this country are in London. And in fact, within London, almost half of the rough sleepers are now in one borough of City of Westminster. in the end, we can bring these things down. The last place I was in actually before the pandemic was Glasgow. And Lorraine had the pleasure of seeing me in Glasgow. Sorry, Lorraine, thought I just mentioned that. The numbers on the street there were really, really low, although colleagues in Glasgow didn't think it could get much lower without a big injection of big investment. There was lots of reasons why it couldn't go any lower. I wasn't really getting that from Lorraine, to be fair, but I was getting that more broadly. Suddenly you have a pandemic and this fantastic achievement they've done in Glasgow, really remarkable, the numbers on the street going so low. There's a lot of begging, I still understand, going on there, but that's another matter. So there's always a challenge, another new, different challenge. There's a whole issue around street activity as well as rough sleeping. But we've now got to now seal the deal and then rough sleeping.
And I think part of the observation there is that an intense moment of COVID plus some new resources and a real focus had huge impacts in terms of bringing people inside. In virtually every city, we've seen that. The question is, how many of those solutions were COVID era temporary solutions versus how much was it leveraged or can be leveraged to become enduring solutions, so that it doesn't see people just coming, as the end of the protections occur. Like, do we have an onslaught of homelessness about to face all of our cities, and how do we leverage this moment? And so I've been asking, I haven't been asking Connor, I had you listening to all of this and intentionally wanting to turn to you after our other panelists made reflection, because I really wanted to get your reaction from the conditions that created your homelessness, the fact that it was not just once, that despite the fact of whatever services you received on the first or second bouts of homelessness you had, it happened multiple times. What strikes you as important, most important about what your colleagues here have said, and what's missing in your mind in terms of what can help to prevent and to the extent people do become homeless, not see that recur?
Absolutely, thank you, Linda. I think within the response to homelessness, I think there are four main challenges. I think firstly, and I think one of the biggest ones, is the lack of ongoing support after housing. Because in my experience, and I know other people's experience as well, it's all good and well to dump people into a hotel during COVID, for example, or more broadly into temporary accommodation, and even moving forward to a system again, something more permanent. But the reality is, a lot of people who have been homeless will be homeless again. There were so many issues that lead up to homelessness, be it obviously the very stereotypical drink, drugs, that type of thing, be it mental health, be it relationship breakdowns, whatever it is. I think there needs to be that ongoing support there to prevent that reoccurrence. I think equally, another big issue, and I think as this year's highlighted, technology. There is a massive reliance on technology within resolving homelessness, but it doesn't work. During COVID, I was doing a lot of work with people who were rough sleeping in the Cambridgeshire area, especially back at the beginning. And lots of them were saying, the government obviously wants to go to their website. We can't do that. Some of us don't have mobile phones. We can't go and get a friend or a family member or somebody within authority to do with us, because we've all got to obviously stay away from one another. They'd say, we can't go to libraries because they're all closed because of COVID. And it leads into a position that's quite difficult to get out of. And later on in the pandemic, obviously, as Jeremy was saying, government really picked up the pace and quite frankly did a really smashing job. But I think there is a problem more broadly. For example, take universal credit. If somebody wanted to claim universal credit, they have to go online to do that now. Aside from going to, say, a job centre, many of which weren't open earlier in the pandemic, there was no way to claim universal credit without doing that through the internet. Equally, I think another big issue within the context of homelessness, like I was saying, to come back to, is very much a lack of ongoing support. Because, for example, I know when I was first homeless, my budgeting skills were horrific, quite frankly. That was a massive issue for me. Equally, skills. I was back when I was first homeless, I was horrific at cooking. It's absolutely horrific, which meant a lot of my budget was done on things like ready meals. When in reality, had I had the facilities and had I had the knowledge and the skills, I would absolutely have been in a much better position, which quite frankly, I think in hindsight, could have pulled me out of homelessness a lot sooner. And then, had I have had that support moving forward, when I was homeless the first time, I'd been kicked out by the family members I was living with at the time. Things ended up resolving within a few weeks, and I got to go back there. And then everything in terms of the statutory services that I, who I'd been speaking to, who I'd been receiving some limited support from over time, completely stopped. When those same family members did exactly the same thing next time round, I was back to square one. And to be honest, it was hard to know where to turn to again, because I felt like I'd received very little support the first time. It made me wonder if there was much point in going back the second time, to be honest.
And how, tell us if you're comfortable, but what made the difference that has prevented your homelessness since your most recent bout? Did something different happen, or did you just figure out how to navigate the world on your own?
Yeah, it's a bit of a mixed bag. I ended up staying with a good friend at the time, just to have somewhere to go. And we ended up moving in together. My friend has been a massive support. We're now in a relationship, which was something I could have never seen coming from 2020. And that's really helped. But equally, I've found, I suppose, a courage, especially over the last year with how different it's been, just to, I suppose, try and stand on my own 2 feet, for lack of a better word. And it's not as easy as that in practice. And I could sit here all day going on about the challenges throughout, but it has felt at times like the statutory services either aren't there, or often, and this is one of my biggest pet peeves, is if you're not homeless 9 to 5, Monday to Friday, if you're made homeless at a different time, you're waiting until Monday morning at 9 a.m, which is wonderful until you can get no help in the meantime, which the reality is, unfortunately, homelessness doesn't fit this bounding box, if you will, of office hours.
So it's interesting. You make me think, and actually, Lorraine, I want to come back to you on this year, the people-to-people connection, and how to unleash this on the issue of the staying with people after homelessness ends. We in New York City, we created a home-based prevention program. So our focus was on creating services that can intervene before the crisis turns into homelessness. Always some kind of instability that is going, has the risk of presenting homelessness. What we found over the years is that at least half of those services essentially are aftercare. The preventive services are most wisely applied to households that were formerly homeless, because they are in fact the ones most at risk of becoming homeless again. And so just in terms of, it's a limited basket of services, and you want to apply them most strategically, and it's really just helping people to continue to navigate the ongoing challenges that
Absolutely
people have, right?
And I know 100%, and I think one of the easiest things to do, but I think is missing sometimes, even no matter how much money services are getting, no matter the economic circumstances, which obviously, as we know at the moment, are going to be quite difficult to navigate over the next few years. I think a lot of the time, I think when you deal with so many people being homeless on a daily basis, and quite frankly, the worst of the world, it is easy to become switched off to it. And I think there just need to be that compassion there. I've spoken to some wonderful, wonderful people within the statutory services who have been absolute gems, who've called me on their days off to see how things are going, who have just put a bit of extra effort in that really makes a massive difference and shows they care. Conversely, I have spoken to some that go, well, if you weren't full, sort it out yourself. And those were their words. And it was just left there. And I just thought, quite frankly, I don't know how they can sleep at night to say something like that. And that's the thing, is, as the famous quote goes, people are going to forget what you said, but people remember how you made them feel. And I think when people are in their most vulnerable position, the least we can do as professionals, as those with lived experience, is simply to listen and just to be there. And I think that can make a lifetime's worth of difference.
And Lorraine, that strikes me as something that all of the folks across systems in Scotland were given permission to do, to be present, to problem solve. How is this question around, really being able to listen, to being freed up from the rules a little bit? Did you see that playing out during COVID, during this period of, greater flexibility?
So I've seen it growing across the two cities in particular over the last 3 or 4 years since we, started that ambition about empowering the frontline and looking at the multi-agency responses. But particularly during that period, and I totally endorse everything that Courtney's just said in terms of that, how you make people feel. And I think the start point to that probably was your health matters. We care whether or not, COVID impacts on you. And then all of the layering of that from other parts of the system to make sure that people were safe, they had access to tech where we possibly could make that happen. They had the health system coming to them. And because the large proportion of the people that we were working with on the streets of both cities have significant and extreme vulnerabilities, there was a huge amount of work that was required. And one of the things that we found that was always the frustration of the frontline street outreach staff was their ability to make things happen quickly, to be able to act in that moment. So having the other services coming alongside us, mental health, addictions in particular, primary care services, we even had smoking cessation programs and vaccination programs going on that were exploiting the opportunity basically of having people within the hotel's environments. But all of those things carried messages. They all carried very powerful messages of your health matters, your well-being matters, and we are willing to do it in the here and now, right now, because that's what works for you, rather than the usual part of the system, which would be, appointment-based, the need to go to other buildings, the need to wait for somebody to come back to you, having difficulties with not having the ability to stay in contact with services, they missed appointments, all of those things that would ordinarily be really challenging in terms, and also message that you don't matter enough for us to make that extra effort. All of a sudden, we were saying you do matter enough to make all of these different levels of extra effort.
One of the things that I'm going to throw a question out there for anyone who wants to jump in. I grew up in a small town, and there was one social service agency, and they dealt with everything. And you just knew that if you had a problem, you went there. And if you had a different problem, you went back there. And if you had the problem again, you went back there again. And they knew you. Everybody knows each other. In cities, I think that while there's a greater abundance of services than in many rural or suburban areas, there's also a lot of providers, and people can get lost, and staff turns over, and there's less continuity. So my question really is around the challenge. How do you tackle this challenge of big geographic area, a multiplicity of providers, and a lack of continuity of connection to the individuals?
So I guess I'll be the first one to answer that. And, we talked about having a system and bringing it to scale. And so one thing we do is, like many United States jurisdictions, we have a system called coordinated access. And that is the front door into our homeless housing response system. And it's kind of like a Priceline, Expedia, an online system that has an assessment tool, and then from there we can see what programs the individual is eligible for and do real-time referrals or put them on wait lists. The magic here is that every single agency utilizes that web-based real-time program. And so now the individual doesn't have to worry about traversing the 600 square miles of the city and finding the right person at the right agency with the right knowledge to get help. There's no wrong front door. So no
and
matter
let me ask this question. So that's, I love that. And I think it's critically important for providers to coordinate. Do clients have access to their own record in that coordinated system?
No. And so clients can ask for their records, but and not all of the agencies have the same level of access. In the US, we have laws regarding medical records and so forth, and a lot of the assessment is asking about their prior and current medical history as well to determine vulnerability. But that's something that is easily shared. We track everything. We track clients now. We're working on who's been vaccinated and who's not, which is important for providers to know, or for outreach work, or for case managers to know to work to get their clients. So we track a lot of information: who's been assessed, who's not, who's chronically homeless, who needs rapid rehousing, where they've all gone. And so, at the end of the day,
yep, no, finish up. Go ahead.
At the end of the day, that is the only way to get into the system, and that is the only way, if you operate housing, to receive referrals, so that we can make sure that the right person is getting into the right intervention, and there's no side doors which end up bringing down the impact of the system.
And so we have a question from one of our attendees about what is the legal structure that allows all of those frontline workers to share information, not just about the resources, but also about the client status. How do we protect confidentiality?
Yeah, so there's agreements that every single, not only agency, but every single staff member who utilizes the program has to sign. And then once again, we control, so not every person and not every agency has the same level of access. Additionally, we do ask clients sometimes to sign waivers, allowing us to share certain data if they agree.
I want to add one thing too, because I think it's important to say that when you're looking at a variety of different service providers, that the quality is important. And what Mark mentioned earlier, the kind of the collaborative approach, I think it's important to establish quality standards. And so having, for example, goal-oriented and client-centered shelters is really important. And so I think that's something that the systems-based approach can address. So establishing quality standards.
High level of accountability is key in defining what those standards are, or else people will just cherry pick whatever data. This is human nature. I would do it. Whatever data helps them out at the end. We want it to be as unbiased as possible.
And then we have another question. This is also complicated. Another question from another panelist around this balance between permanent solutions, housing, and home-based support to prevent and aftercare to prevent reoccurrence, versus investing in the infrastructure for people who are experiencing homelessness. So those high quality shelters, but also the facilities. This particular question comes from Megan Preston. The argument that for people on the street, they need things like, showering facilities, they need storage facilities. And if we don't have something to offer them right now, or if they're not ready to accept, how do you balance the interventions that can humanely address their needs while they're on the street without taking away from the real solutions, or even exacerbating and extending the time on the street? How do we find a balance between those two things?
I always feel like actually those are, to me, those are tools, those are resources to bring people in, to engage people, to better engage people. And so if it's a storage, if it's a locker, mobile showers, it should be used as a mechanism to better engage people, to get them into services. So that's how I see it. So it's somewhat of a carrot, but it's also another opportunity to convince someone that if there is an opportunity to move into housing, if there is an opportunity to move into a hostel, or to engage in behavioral health services somehow, this is an opportunity to engage that person. So that's how I see it.
Jeremy or Lorraine, maybe.
I think one of the impact of the pandemic in terms of the congregate shelters we have in this country has been enormous, because one of the first things we did was to move people out of those shelters into hotels because of the level of sharing that was involved. And the faith groups in the country were just remarkable in the way they engaged with that and encouraged that to happen and supported it, even though in a sense it was taken away from them, the traditional work they'd done, which was to support people in those shelters. The challenge for them now is to find a way of providing services differently, because I suspect we won't be going back to having shelters to that level, meaning where people are sleeping next to each other on mattresses in dormitory space. That's going in this country, and most of us feel that's a good thing. Obviously, it has to be replaced by something that's different. We were talking earlier about a one-stop shop approach. Now, some of the church groups are now running spaces during the day where statutory bodies can go, where the council can actually attend to talk to people and to assess their housing need. So there's a coming together of the faith groups and the statutory sector, which I think is really impressive. I think the big challenge is the one that's been pointed out, which is that whilst you have people on the street, you still need some immediate way of helping people. And of course, people need food and they need somewhere where they can wash. But obviously, if we can find a way of people doing that in the best possible circumstances, the best possible situation, that is what we should be achieving. And to have your own front door and to be able to go in and to be able to use a shower that isn't being used by another 30 people where you have to queue up, but it's being used either by yourself on your own or by a small number of people, is where we have to be. And the temptation is to go back to providing basic services on the street. And that I think would be a real mistake. What we've learned from the pandemic is we want to get people off the street. We're not doing it quickly enough. We want to get them into basic hostel accommodation sometimes. We don't want them staying there very long either. We want people moving upstream into more humane situations where they can live and they can have settled accommodation, and that can be their new life. That has to be the objective, which is why the biggest investment made by government during last year was the rough sleeping accommodation programme, as it's called, which was a 433 million investment that we actually front loaded for the pandemic year. So we brought forward 160 million of it in year one, the long-term accommodation, which we know everybody needs. Now, that isn't enough. It's never going to be enough, but it is the long-term solution that had to be the focus. And that's the challenge over the next period, to make sure we can move people into that situation where they never need to return to the indignity of trying to find somewhere to find a shower because they're sleeping rough.
And is this just a question of resources? I mean, if we see that during the COVID period, because of the health requirements, that people were given more privacy and more more private accommodations, and we want to move to a better system after, will that be capable of being done without an infusion of resources, or is this going to necessarily cost governments more money?
Well, you're going to need the long-term investment, isn't it, for this next period. By the next period, I mean for at least the next 10 years. But obviously, what you need to do is to invest in a system that's preventing homelessness in the first place. I think one of the most exciting things we've done in the last few years in the UK is develop the Homelessness Reduction Act, which is a way in which people can get earlier access to support when they're at risk of homelessness. 56 days before you're due to become homeless, you can get support. What that's done actually is it's increased the numbers of people who are technically homeless, because people who couldn't access the system before, particularly single people, can now do so. So it looks like the numbers are going up, and indeed they are, in terms of the numbers of people being supported. So I think the Homelessness Reduction Act and that much greater safety net we can offer people around prevention is absolutely key. But I don't know whether we can reach there, Linda. I mean, I cannot emphasize enough what an important moment this is now. And the other thing we've got is a relationship between housing and health we didn't have before the pandemic. I mean, we've got health colleagues who were amazed at what they were seeing in terms of the profile of the rough sleeping population. I'm not just talking about, every kind of physical health issue, the ones we know, you know, hepatitis, diabetes, obesity, which is bizarre amongst the population that it's not eating enough, but that's the way it goes. And health colleagues were really taken by this, and they've got some good data, much stronger data on the homelessness population. Getting the data is great. Delivering on what the data is telling us is absolutely key. And there has to be a way in which people who are rough sleeping, and often rough sleeping for years, can reach the threshold where they get the support they need without having to try to navigate a system that doesn't allow them to do that. So again, the health housing relationship is fundamental. So faith groups, health colleagues, housing, we're in a place which is so different from 18 months ago. Very exciting.
And Lorraine?
Yeah, completely. It is really exciting, and it is a big moment in time. And I do think that we focus an awful lot on the cost of doing things. But right now we've got to focus on the cost of not continuing to do what we're doing, both in economic terms and in social terms. We have massive opportunity costs in the wings waiting to kind of descend upon us if we take our eye off the ball on this. And I think that the health part of that is about, you know, it became not okay to have people on the streets because of a health impact.
Right.
You know,
right.
It became not okay, and a system responded because of a health impact. We need to make it always not okay. And I think that we are seeing people on the ground in terms of local systems and local responses, particularly in Scotland, who have got that and are still using that absolute as the imperative to drive, to make sure that even our most extreme emergency responses, like what would have been previously night shelters, are no longer tolerable within the system, not because of a health pandemic, but because we now see that they are no longer tolerable, and we now see that we can do things differently and we can offer a much more dignified response. And I think we need to extend that out even to the most basic amenities like the storage of people's belongings, even when they're in emergency accommodation, because some of the units don't provide, some of the hotels, it's budget hotels with no storage. So there's even a consideration there in terms of providing a dignified response. And it is an opportunity again to say, we care, we matter, your stuff matters, we want you to feel valued, we want you to have a similar experience to anybody else who's facing a tough time. And for it not to be at the very extreme end where you have to feel okay about sharing a shower in a rundown building, or feel okay about storing your goods alongside everybody else's in plastic boxes in a room somewhere. We need to lift that out, and I do think the pandemic has helped, and it's helped us do that partly because of the points that Jeremy was making there about other parts of the system really seeing this group of people for the first time in a very different light, because they were much more of a captive audience and they were able to engage in a much more structured way with them. But I just think we need to just keep our eye on the cost of not doing as much on the cost of doing.
Can I add something to that? Because I think that so that's a great point. You could better use dollars, but it does require dollars, and something along the lines of a strategy like Housing First is not just an intervention, it's prevention as well. It's tertiary prevention, the kind of language we use in public health. And so it's a solution, and it's prevention, but you do need funding. And it's interesting to see a case study like LA, the city of LA, when the question was put to voters, would you impose a tax on yourself to raise funds to address homelessness because we're not going to rely on the national government? The voters said yes. So I don't know if LA is representative of any other places, but it's a really interesting decision. And I think you have to tie to that conditions to invest those funds wisely. And they did tie conditions to use some of it for temporary accommodation, but also building affordable housing, permanent housing, and supportive housing as well.
And so I'm going to leave the last word for you, Connor. Tell us, I saw you nodding quite a bit, both while Jeremy and Lorraine were each speaking about this balance of services on the street while people are homeless compared to prevention and permanency. What would be your advice around how to strike that balance? And what was your experience that worked for you?
Absolutely, thank you. I think the problem is there's not enough money. And I think we all know it, unfortunately. I think the key point I want people to take away is compassion is a one biggest thing. As I say, it's all good and well trying to prevent people going into homelessness, and that's great. It's great trying to take people off the streets. But the reality is, if you've not been in that position, you can't understand a lot of the time why people are in that position and the journey they've taken to get to that position. It's a time when people are the most vulnerable in life as it is. I think a little kindness just goes a long, long way in that position.
Thank you for ending us with that most important thing. We need an evidence-based kindness program, please. Amazing conversation. Thanks to everybody on this panel. You've dedicated your lives and saved so many others, and we really appreciate all the work you do and that you are willing to take an hour to spend with us here this afternoon or this morning, depending on where you are. Thank you very much. And thanks to all of our participants. We're very grateful for your questions and participation, and we encourage you to reach out with any further questions. And I'm sure the great staff of the Center for Homelessness Impact will facilitate responses. So thank you.